Hi, I'm Terry Vinson and I'm the Managing Director and Formulator of Synergie Minerals, Synergie Skin and Synergie Practitioner. And today I'd like to talk to you about a very important protocol that we've introduced to many of our clinics through Australia, the Synergie Transdermal Infusion protocol. And like the name implies, it infuses active ingredients through the dermis into the skin and targets the cells that it needs to affect. The Synergie Transdermal Infusion protocol involves galvanic current, and galvanic current is simply alternating current or alternating charge, and it's based on the fact that like repels like and opposites attract. So it's all based on electrical charge, and it's all based on the charge of the solution and the charge of the machine. So if the machine is positively charged, or the electrode is positively charged, and the solution that you're infusing into the skin is positively charged, like repels like. And as we know, the skin is a natural barrier to most ingredients. Using galvanic current and transdermally infusing the right solution, you can get 400 times the penetration of your actives versus massaging it into the skin on its own. The other great thing about using this protocol is the machine, which you can get from most salon suppliers, is usually under $500. Your consumables are low, there is no downtime for the client, and they get results. It has been to many of our clinics a huge cash cow for them, and it's been a signature treatment for them, as long as the therapist has a clear understanding of acids and bases and what ingredients can be mixed, and we're going to go through that thoroughly in the protocol. So as I said, like repels like. So if the therapist has the positive electrode and the client is holding the negative electrode, the charge goes from positive to negative. We have got a positively charged solution. Acids are positive, bases are negative. So if we're infusing on the positive charge, we have to have acidic solutions. And what better base for an acidic solution than pure L-ascorbic acid? And Synergie pure L-ascorbic acid crystals is the basis for the transdermal infusion protocol. So we mix the crystals at 25% with 75% solution that's relevant to that client's particular condition. That's the beauty of this protocol. You can actually tailor it to suit the client. So if the client, you can just use L-ascorbic acid if you want in hydrogel, or if you want to address pigmentation, you can mix it with Vanish. If you want to address acne, you can mix it with Decongest, or if you're using Synergie skin products, with Blemex. If you're wanting to address severe congestion and just general tired, dull skin, you can use exfoliating serum or Reveal. So do you see the pattern here? We're using positively charged ingredients with the L-ascorbic acid. We're creating a positively charged solution with a positive current. Like repels like, we're pushing it into the skin 400 times more effectively than just massaging it alone. So remembering we're using our positively charged ingredients, we're not using A and B, because remember A and B are more on the alkaline side, they're not acids, and they're negatively charged, and that's another protocol again that will be putting it onto the negative current. So we will also go through the protocol in great detail, but the theory is like repels like and opposites attract. And if you understand your solutions and you understand that L-ascorbic acid at 25% is the basis, and you can add other solutions from the Synergie range that are acidic or that don't mind acid. Hydrogel is a great one also. It can help make the solution work better too. You can actually mix it more easily. The other thing is you need water to conduct the electricity, and that's the steamer. So the steamer is constantly on the client's face, producing a carrier for the electric current. You don't lift the probe off the client's face because it will short out the circuit, so you have to restart the machine. Leave constant touch with the client's face. Never do the treatment when the client is pregnant, lactating, has a pacemaker or large metal plates anywhere in the body, but that should be done in the consultation process. Your trainer, your Synergie trainer, will talk you through the protocol. You also have a copy of the protocol manual that you all should have. Every clinic should have a copy of this manual, which takes you through all our peels, our medifacials and the transdermal infusion, and also your product manual, which will tell you each product and how best to use it. So I really believe this particular protocol will take every therapist to a new level with their treatments, and I hope you enjoy performing the treatment. And now onto the protocol. Okay, let's get started on the actual transdermal infusion protocol. So we start by double cleansing the face with Synergie Ultra Cleanse. Now remember, a cleanser is simply designed to remove excess makeup and grime without stripping the acid mantle. It's quite unnecessary to put extra active ingredients in a cleanser. Often cleansers will have glycolic acid or lactic acid, but why push something on your face or something in a product that's only going to be on the skin for a few minutes at most, even a few seconds often if you're cleansing at home, and then the place it usually goes down is the sink. So what I put in the cleanser is gentle ingredients that won't strip the skin and do the job, which is remove makeup and grime. In a clinical situation, we always double cleanse, and as you can see, we're using gauze, and she's using a slightly exfoliative action there to remove a lot of the dead skin while she cleanses. Also, Synergie Ultra Cleanse contains coconut-derived foaming agents. I don't use sodium lauryl sulfate. SLS is actually a highly irritating ingredient, and they actually use that for the benchmark of irritancy against other chemicals. I prefer not to use anything questionable in Synergie products, so we don't use sodium lauryl sulfate in any of our products. Also, the high foaming action enables all the makeup and grime to be removed, but we also have BioCleanse, which we don't tend to use so much in the clinical procedures, but BioCleanse is our gentle cleanser. It's more of a creamy cleanser. It's very low foaming, again, no sodium lauryl sulfate, but suited to a skin that is perhaps a little bit drier, a more aged skin, or even a more sensitive skin. So that's the first cleanse. Okay, so we're just going to do another cleanse. Okay. So another cleanse. And this will make sure there is no trace of makeup or grime or cell debris on the skin. Now note that we always wear gloves when we do treatments, again for hygiene purposes. If you're performing a facial massage at the end of a treatment, you may take off your gloves if you prefer the feeling of skin on the face, but generally when we're doing these types of treatments or peels, we'll always use gloves. And note the movement, small circles, making sure she gets to all the areas, and very rarely do her hands leave the client's face. The client loves to feel touched and nurtured completely, and we make sure that we do that process with the client. So it's important also to note the method of cleansing. So we're using the gauze again. It's very, very important that we get the stimulation and the blood flowing to the surface of the skin. And also we're preparing the steamer because we will be using the steamer very soon. So you might see a little bit of steam in the picture soon. That's very normal. We need to prepare the steamer and get that going for the client, because the next part of the procedure is the steaming part, which is very important. So the last remnants of cleanser will be removed now with Fabrella. Thoroughly removing all traces of makeup or cell debris from all over the face, especially around the nose and the forehead. Now the next step is very important, and this is the degreasing step, and we're going to use Prepare. Now Prepare is an astringent. I don't like the word toner. I don't believe anything can close the pores unless you stimulate the collagen around the follicle, but in saying that, this is excellent for removing any excess oil or debris from the skin. It is a thorough degreaser, but it's very low in alcohol. Synergie uses high levels of witch hazel in this product with a little bit of grain-based alcohol as well, and I use chlorophyll, which is the colouring, as an antioxidant. So this is actually going to remove any last traces of oil on the skin, because one of the main reasons that treatments can fail is a surface layer of oil that impedes the penetration of active ingredients. It may feel a little bit cooling to the client, but that's quite normal. And again, what are we using gauze for the Prepare, the Dermaprep? Now the other thing we might like to do is put some cotton pads on the client's eyes for this procedure, and this will protect their eyes because we will be using vitamin C crystals, which is basically L-ascorbic acid. So we're just going to put a little bit of protection over the client's eyes during this process, and you also might like to put a little bit of Revitalize under their eyes and give them a little bit of an extra eye treatment as well, just a little dab of Revitalize. So the Revitalize has our peptide technology. It has the Trilogen peptide, which stimulates the collagen and reorganizes the collagen matrix. And remembering, we also have the iCyril, which is another peptide, a tetrapeptide, and that works on fine lines, dark circles and puffiness. It actually aids in lymphatic drainage around the eyes. So it works on all areas of concern that involve the eye. Nice little treat for the client. And it's also a light serum. The good thing about Revitalize is that you can actually use it during the day under your makeup, and it won't leave that residue which a lot of heavy eye creams often leave. So I'm just going to give Dina a nice eye treatment now while she's having her treatment. So while we're steaming the face, the steam is now on Dina's face and it's creating a layer of water, but it's also opening up her pores and creating an extra blood flow. We're going to mix up our concoction, our special potion, to transdermally infuse into the skin. So this is what I love about this treatment. You can actually be incredibly creative as a therapist, because you can add your vitamin C crystals to any number of Synergie serums. I suggest you get a professional size vitamin C crystals. You need about 25% vitamin C crystals to 75% of your other serum. Now today we're going to use Vanish on Dina's skin because Dina has a little bit of sun damage and pigmentation. So we're going to use 25% Vanish on 75% L-ascorbic acid crystals. So we're going to create a nice little paste of the two products. We're going to mix them together and we're going to transdermally infuse those. So we're just making a nice mixture so it's all mixed together. Vitamin C dissolves beautifully in the Synergie serums. And now Dina's face is wet from the steam, and that is the conductor. Remember, we can only use an electrical current if we have a conductor, and the conductor in this case is the steamer, the steam from the steamer, and the beautiful blend of ingredients that we've made up for her treatment. So we're going to apply that serum mix to Dina's face. So we've got vitamin C and Vanish. So we're going to be working on collagen production. We've got an antioxidant. It's great on any old scarring. It's going to work on her melanocytes. It's going to downregulate melanocyte activity, and she'll get a lovely skin lightening effect from it. It will take more than one treatment to see long-term results. We do recommend at least 6 treatments. Now also we'll use a layer of hydrogel. This is also a great conductor. It's a gel-like conducting agent. It helps the ingredients diffuse even more effectively into the skin. So we layer a fine layer of hydrogel over our acidic solution. Now remember, anything we're using on the positive transdermal current today has to be acidic. Any acidic solution has a positive charge. And we know that vitamin C, L-ascorbic acid, is an acid in itself, so that's going to create a positive current. And we have to mix compatible serums with the vitamin C. So anything that has a positive charge or it doesn't get neutralized if it's added to an acid can be added to L-ascorbic acid. So we can add, if we want, we can add our decongest if we want to address acne. We can add our exfoliating serum, our Exfol-X, if we want to address deep sun damage or other forms of acne or just general thickening of the skin, or we can even use vitamin C alone. And she's doing is preparing the electrodes, and she is holding the positive electrode. That's the electrode that actually pushes the ingredients through, and Dina is holding the negative electrode. So we turn it on, and it's on the positive, so the switch is on the positive. And then we've got that green light, and then we're going to take it. Right, just one bar of the red. That to there. We've actually coated the gauze with a bit of water so that Dina has a conduction from the positive to the negative, and now we're rolling the positive electrode over Dina's skin and putting the charge on. So we're rolling that over the face, and we roll for about 10 minutes. Try not to lift it from the skin. You won't electrocute yourself or the client if you do, but if you create a constant current, you won't short it. You might have to start over again if you lift it off the skin. So make sure you keep contact. Make sure you keep the skin moist with the steamer and roll gently over the skin. Carolina, you can go over to the other side now because we've shown our clients how to do it on that side. So we can move over and just slowly and gently roll over the skin for at least 10 minutes. Now the client can have a longer treatment if they wish. You can also take the treatment down the neck and décolletage. So the face should be nice and moist. So now Dina's ingredient is penetrating 400 times more effectively than if she just rubbed these ingredients on her skin alone. So you can imagine the long-term benefits she has from the transdermal infusion using galvanic. Very effective treatment, and we're really getting those ingredients in to target the cells that need them. The melanocytes that are overly active, any skin that needs rejuvenation, the fibroblasts that need stimulating for collagen, and we're doing it in a lovely, gentle way. Now, transdermal infusion can be performed on virtually any client, but there are some exclusions. So make sure that your client signs a consent before she or he undergoes a transdermal infusion series. And if they do have any contraindications, we need to be aware and obviously not perform the treatment.
Yeah, turn it down and then turn it off. That's it. Otherwise you blow up the machine. There you go.
Okay, so we've transdermally infused those ingredients now. And so remember, the client has the negative electrode wrapped in moist fibrella, and she's held the positive electrode. And try not to lose contact with the face. Now the client should feel a tingling sensation. Dina, did you feel a tingling sensation?
Yes, definitely.
And a bit of maybe a metallic taste in your mouth? That's quite normal too. So now we're going to apply De-Stress, which is a beautiful infusing pure olive squalene based oil. It nurtures, it hydrates the skin, and it's a lovely way of performing almost a medifacial style massage on the client. Depending on how long you have with your client, this massage may be just enough to apply the product, or it may be a good 10-15 minutes on the neck and décolletage as well. But the client should be relaxed and hydrated now and have a nice flushing to the skin. Now, if the client does have redness or irritation following this procedure, which is highly unlikely, but if they are sensitive to L-ascorbic acid, I do suggest you apply our ICU gel. It will instantly calm any redness or irritation from the skin. It's a serum. And then after you've applied that, leave it for a little while for the heat to dissipate, and then you can use the de-stress straight afterwards. You don't want to use anything too oily if the skin's very hot and inflamed, because you can actually trap the heat into the skin. So the ICU gel, and if you don't have that, you can also use the Medicalm, which is a calming product. I'd love to be under those hands. The other wonderful thing about transdermal infusion is there is absolutely no downtime. So you can have the ICU gel there, and please have a look at our manual to get further details of the ingredients, but it has anti-inflammatories, it has phenolide in it, it has phycosaccharide A1, which is a marine phytoplankton glucosaccharide, which actually causes the cells to produce their own their own growth factors, and it causes a great deal of very, very fast repair on the skin, and it's a potent anti-inflammatory. How do you feel, Dina?
Fantastic.
Good.
Very relaxing.
Okay. Now, of course, we never let a client leave our clinic without sun protections in the form of Uber Zinc. So we're going to apply Uber Zinc on the face. This is 20% zinc oxide with green tea as an antioxidant. The green tea gives it that light tan colour. We pat that gently into the skin. Again, we'd recommend the client have at least 6 treatments. You can have them ongoing every fortnight. This is an on-demand treatment. There is no downtime. You can have it on the day of an event and your skin will look plumped and firm for the event. So it's a great pre-party treatment, but it's also a cosmeceutical infusion treatment. So it's actually a win-win for everybody.